Bismillahirrahmanirrahim. I am Dr. Alishba Rasool, and I will be presenting the topic Leadership Issues in Health Sector under the kind supervision of Professor Dr. Saira Afzal. The quote of the day is, "The boss drives people, the leader coaches them. The boss depends on authority, the leader on goodwill. The boss inspires fear, the leader inspires enthusiasm. The boss says I, the leader says we. The boss fixes the blame for the breakdown, the leader fixes the breakdown. The boss knows how it's done, the leader shows how. The boss says go, the leader says let's go." Learning outlines, leadership, leadership roles, functions, and qualities, leadership development plan, difference between a manager and a leader, issues in healthcare leadership, recent updates, and MCQs. At the end of the presentation, participants would be able to describe the leadership role, its qualities and functions. They would also know about the leadership development plan and challenges faced by leaders in healthcare. The slide shows famous leaders in healthcare in Pakistan. What is leadership? Leadership has been defined as the process by which an individual determines direction, influences a group, and directs the group towards a specific goal or mission. Leadership role. Leadership role is one where you are responsible to manage a situation, a team, or an entire organization ethically and effectively. Leaders have the skill to influence and guide their team in a shared strategy. They are also responsible for building and maintaining employee morale, helping employees reach their full potential, and inspiring employee loyalty. Different roles played by a leader: navigator, strategist, entrepreneur, change agent, motivator, and captivator. Functions of leadership: setting goals, take initiatives, organizing, cooperation among employees, motivation and direction, liaison between workers and management, and policy making. So the following diagram shows the different functions of leaders. Leadership qualities: be a good listener, be disciplined, stay alert of the potential issues, give and receive feedback. The leader possesses the following qualities: honesty, willpower, courage, selflessness, visionary outlook, consistency, knowledge, efficient communication, and honesty. Now, what is leadership development? Leadership development is the process which helps expand the capacity of individuals to perform in leadership roles within an organization. Leadership roles are those that facilitate execution of an organization's strategy through building alignment, winning mindshare, and growing the capabilities of others. Leadership development plan: self-paced micro-learning, leadership mentoring, job rotation, job shadowing, professional certification, professional development course. 5 characteristics of a successful leadership development strategy. 1, a blended delivery approach. 2, broad and sustained support. 3, a focus on workplace realities. 4, interaction and engagement. 5, use of tools and assessments. Leadership development framework: influence others, develop teams, develop positive culture, mission focus, live the ethos and values, think smart. 7 principles of leadership development: skilled knowledge, selection for leadership, leaders and as mentors, education of leadership, strategy for leadership development, integrate executive leadership and coaching, the chance to lead. Leadership development phases: the emerging leader, moving from technical individual contributor to leader, managing versus leading, managing meetings effectively, clarifying roles and responsibilities, building formal and informal networks, managing day-to-day while considering the future. The developing leader, focusing power and influence, creating greater company-wide exposure, leading by example, leveraging personal insight, creating alignment behind strategies, managing priorities. The strategic leader, obtaining and sustaining business results, isolation, inadequate feedback, work-life balance, managing succession planning. WHO Leadership Development Initiative in 1985, Initiative for Health for All. It was recognized that leadership is vital to achieve health for all by primary healthcare approach. The WHO framework for approaching leadership and management strengthening in health, overall actions to strengthen health systems, adequate number of managers, appropriate competence, enabling work environment, functional support systems. Healthcare leadership model, the 9 dimensions of leadership behavior. The healthcare leadership model is to help those who work in health and care to become better leaders. It describes the things you can see leaders doing at work and is organized in a way that helps everyone to see how they can develop as a leader. Now, what is the difference between leadership and management? Different between roles and characteristics of leader and manager. Leaders will focus on objectives that are developed by managers. A leader interacts with the employees. A leader works with the team. Leaders implement the ideas of the managers. They focus on employees. Their main responsibility is to inspire their employees. They motivate workers for performance improvement. Leaders can influence employees to give the best outcome. Managers will develop business objectives for the organization. A manager interacts with the leader. A manager gives instructions to the groups. Managers invent ideas. They focus on resources. Their main function is to develop plans. They instruct the subordinates to perform better. Managers encourage leaders to motivate the employees. Leadership and management. Leadership setting direction for change, aligning people to the vision, inspiration and creativity, behaviors and competence. Whereas management is transactional, planning and budgeting, structure and staffing, control and problem solving, processes and skills. Leadership in healthcare is unique in that there are multiple stakeholders, clinicians, like medicine, nursing, allied healthcare, managers, bureaucrats, politicians, advocacy group, and the media. Evolution of leadership. First, you lead yourself, then leading other individuals, leading groups and teams, leading groups and organizations, and then leading communities. International issues and challenges for healthcare leaders. Sustainability, community patient expectations, clinical governance and accountability, the way health services are delivered, workforce capacity and sustainability, political influence and intervention, performance improvement and patient safety. Successful leadership in health, a focus on the mission and values, a culture of teamwork and change, communication and transparency, rewards and recognition, and leadership development. Transformational leadership in healthcare, empowering workers, negotiating workplace goals rather than issuing orders, making managers accountable to their goals. Recent updates. Leadership challenges in healthcare organization, the case of Iranian hospitals. Background, effective leadership is a vital component of healthcare system and has an extensive range of functions in improving organizational effectiveness and efficiency. This study aimed at exploring leadership challenges encountered by leaders in Iranian hospitals. This qualitative study was conducted on a purposeful sample of 27 members of hospital management team in Tehran, face-to-face semi-structured interviews and in-depth interviews. Thematic analysis was used to analyze and report the data. In this study, 5 main themes emerged upon the challenges of leadership in healthcare organization as follows: organizational structure, complexity, centralization, bureaucracy. Human resources, the number and distribution of human resources, staff empowerment and education, motivational mechanism, and staff diversity. Work nature, sensitivity, stress, tension, customer diversity, and team-oriented. Leaders, knowledge and skills, appointment, superiors and colleagues and time. Context, regulations and programs, cultural issues, social issues, and economic issues. Conclusions. The results of the study shed some light on the leadership challenges in a culturally specific developing countries. The results also proved the importance of using educated leaders who are capable of understanding, analyzing, and dealing with such complex challenges. Priorities and challenges for health leadership and workforce management globally, a rapid review. Health systems are complex and continuously changing across a variety of contexts and health service levels. The capacity needed by health managers and leaders to respond to current and emerging issues are not yet well understood. Studies to date have been country specific and have not integrated different international and multi level insights. This review examines the current and emerging challenges for health leadership and workforce management in diverse contexts and health systems at three structural levels, from the overarching macro, international, national context to the meso context of the organization through to the micro context of the individual healthcare managers. A rapid review of the evidence was undertaken using a systematic search of selected segment of the diverse literature related to the health leadership and management. A range of text words, synonyms, and subject headings were developed for the major concepts of global health, health service management, and health leadership. An explorative review of the electronic databases was undertaken to identify the key publication outlets for relevant content. A search strategy was then applied to the key journal identified, in addition to hand searching the journals and reference lists of the relevant papers identified. Inclusion criteria were independently applied to potentially relevant articles by 3 reviewers. Data were subject to a narrative synthesis to highlight key concepts identified. 63 articles were included. A set of the consistent challenges and emerging trends within healthcare sectors internationally for health leadership and management were represented at 3 structural levels. At the macro level, these included societal, demographic, historical, and cultural factors. The meso level, the human resource management challenges, changing structures and performance measures, and intensified management. And at the micro level, shifting roles and expectations in the workplace for healthcare managers. Now it's time for MCQs. Number 1, the process which helped expand the capacity of individuals to perform in leadership roles within the organizations. A, leadership phase. B, managerial development. C, leadership development. D, leadership strategy. Or E, leadership framework.
C.
Yes, C is the right answer. It's leadership development. Difference between the main function of a leader and a manager is: the leader inspires the employees. The manager inspires the employees. C, the leader develops plans. D, the manager gives direction. Or E, the leader focuses on resources.
A.
Yes, A is the right answer. Which of the following statements best capture the nature of leadership to ensure future success? A, leaders focus on budgeting, aligning people with shared vision and solving problems. B, leaders focus on setting directions, aligning people with shared vision and motivating people. C, leaders focus on motivating people, planning and staffing. D, leaders focus on skills and trainings. E, leaders focus on communication and budgeting.
B.
No,
C.
it's A, leaders focus on budgeting, aligning people with shared vision and solving problems. A person is recently posted as the CEO of a district. The staff there is competent, however, they are having some tensions from multiple sources and organizational structures and culture changes. These factors may present as A, enabling for leadership, B, challenges in leadership, C, acts as a leader in progress, D, competent leader, E, incompetent leader.
B.
Yes, B is the right answer. Informal relations at private hospital will help employees in getting advice and boost overall performance of the hospital is called A, peer leadership network, B, organizational leadership network, C, field policy leadership network, D, collective leadership network, or E, interpersonal leadership network.
B.
Yes, B is the right answer. People who become leaders in any field tend to first stand out by virtue of their A, interpersonal skills, B, technical proficiency, C, emotional intelligence, D, intercultural competence, E, education.
A.
Yes, A is the right answer. The process by which an older and more experienced person helps to socialize and encourage younger organizational colleagues is called A, evaluating, B, consulting, C, mentoring, D, networking, or E, organizing.
C. Mentoring.
C.
Yes, C is the right answer. What is the preferred leadership style in healthcare? A, transactional, B, transformational, C, charismatic, D, servant, E, contingency.
Transformational. B.
Yes, E is the right answer. Why is leadership important in healthcare? A, for improving resources, B, for improving quality of care, C, for improving work ethics, D, for getting things done, E, for facilitating the health staff.
B.
B.
Yes, B is the right answer, for improving quality of care. Managers regularly take time to talk to salespeople about things that are important to them. A, never, B, rarely, C, usually, D, always, E, occasionally.
C.
D.
D is the right answer. This is the key of our MCQs. Thank you, everyone. Please like, share, and subscribe to our YouTube channel.